9 people have died on Denver streets over the last 9 days. Now, there are assumptions as to why, urgency to find out why, yet it will likely be months before the coroner's office puts out something official. Advocates trying to reduce overdoses in the city tell our Jaleesa Irizarry this is part of the problem.
Lately, those on Denver streets can count on one thing: a growing body count.
1 last night, 2 the night before, 1 on Friday night, 2 on Thursday, 3 last Monday. Like, what? It's like so many, it's so overwhelming.
Lisa Ravel is the executive director of the Harm Reduction Action Center. The string of outdoor death investigations she's talking about started last Monday at 14th Avenue and Race around 7:30 that morning. Since then, DPD has reported 8 more outdoor death investigations throughout the city. The most recent happening at 17th in California early yesterday morning. Ravel believes these deaths may be drug-related.
People who use drugs are saying it's the powder right now, but again, they'll need to confirm that with other folks.
We tried, but the reality is the city won't have that answer for a while. The Denver Department of Public Health says they have recently seen an increase in non-deadly overdoses, but can't say how many have been fatal because toxicology results aren't back. According to their website, we'll likely be waiting on those for 70 to 90 days.
In 12 to 18 weeks, I'm not going to care about that supply because we're going to have something different. It's going to be shifting. We need better communication. People are dying and they're dying publicly, and we can do better.
Denver's health department says they get those frustrations, but the delay is because they have to send their toxicology information to a lab out of state to get the results. A long wait. Rayville fears may shorten lives.
We want to make sure that people have really good factual health information because we don't believe people should have to die of a preventable overdose.
Denver's health department says while they have had a total of 10 outdoor deaths in all of March, they say it's important to keep in mind some of them could have died from natural causes or a traffic crash. We asked if any of those deaths showed obvious signs of blunt trauma, and they would not say.
Why is this stuff going out of state for testing and analysis?
Yeah, that's an excellent question. So they say they need to send this evidence to a certified lab and one that has credentials to be able to testify in court. And apparently none of those exist in Colorado.
That sounds like a whole other story. All right, Jaleesa Irizarry, thank you very much.